should I make a list of all the medications that I'm taking before I meet with my pharmacist? And should I share that list with them before I visit my pharmacist? I've got to think not only about other prescription medications, but I need to be thinking about anything that I'm putting in my body that's over the counter, vitamins, or any other substances, even recreational. So you guys aren't judging the patient. You just need to know in terms of giving good information to that patient about how those medications can influence their health overall.
And I could give you an example. Say some patient is taking a once a day antibiotic, okay, and they take it every evening. Well, they also come home every evening and they like to have a drink or two. They had a long day at work and they want to have a drink and whatnot. So you're coming home and you're think, geez, can I take this medication and alcohol? And for the most part, we separate the two, and it's a good idea, and we don't encourage that. However, this patient who comes home and has 2 beers, 3 beers every night says, I can't take my medication because I'm having alcohol. And let's say this patient does that 4 or 5 nights a week. Out of a week's worth of therapy, he would have received 2 doses. Mm-hmm. Now, as pharmacists, we would probably say something like, we don't think that it is truly necessary to be doing both. However, the risk of missing that medication while you're having your 2 beers is much, not treating that infection because you're not taking the medication is much bigger than that problem of taking the antibiotic with the beer. So okay. That's why I think that's an important conversation to have.
So something that I may not want to share, I still need to because of how it can impact me, and I need to be able to have that information and give you all the full picture to give me the
absolutely.
Okay. And we also have laws protecting patients. We have HIPAA laws. I mean, it is against the law. I can lose my license if I share what you say to me with just anyone else. You are protected. Obviously, there's a lot of trust that needs to be built up, but you are protected with the law. That's a huge thing. So that's why I try to tell people to be as open as possible with any sort of health professional.